Hi, everyone. I'm going to get started soon. I know everybody is kind of jumping on, so welcome. And I hope everybody's been having a great day. This webinar will be recorded. It's actually, the recording has already started. So if you prefer to not have your faces on, since this will be shared with other patients who aren't able to make the webinar, you're welcome to keep your videos off. You are welcome to keep them on. Just know that the video will be shared and there's a possibility that your video will show up on there. As we get started, I believe there is a chat box that you are welcome to input any questions you might have for me on there, and I will have some time at the end to hopefully answer any questions that people might have. We're going to try to go from 4 to 5 o'clock. That's what we're scheduled for. And of course, there might be people jumping on and jumping off throughout, and that's absolutely fine. I will be in a moment sharing my screen and putting up some slides and doing a little talk for you guys. So I am going to go ahead and get started. We're right about 4 o'clock, and I see many of you on here, so it's wonderful to see everybody. Welcome. I am Dr. Kristen Coles. I am one of the physicians here at Steelsmith Natural Health Center. So today I'm going to be talking a little bit about some updates on COVID. We'll be touching on sort of acute COVID infections. I will be talking about something known as long haul COVID. I'll get into that a little bit. And then the part of the reason, I wanted to do this webinar and bring it to everybody is just to talk about a recent experience that myself and my family had with our first COVID infection personally. And I'll talk a little bit more about that and just some interesting data and some things that we noticed with that. So I, again, encourage you, if you do have questions as we go along, to put them in the chat box, and I will do my best to check that at the end and answer questions that we may have. And I'm going to share my screen for a slideshow. So just a moment. All right, here we go. So we're going to talk about COVID updates. Where are we? Here we are. We're halfway through August of 2022, and you may be like me, where you just really are shocked that we're still talking about COVID at this point. It's kind of been quite a while, the last 2 years. So I'm happy to be here to just kind of talk about where are we in the world of COVID and what we're seeing and what does that mean for you as patients, you as people, that kind of thing. So I'll be talking first about acute COVID infections, and then I'll be talking about long haul or long COVID infections or long COVID symptoms as well. So acute COVID, I'm not going to get into the details of what COVID is. I think all of us are well aware that COVID is a viral infection. We should be well aware of the history. Currently, the circulating strains of COVID worldwide are still known as the Omicron version. We've gone through different versions of the COVID virus infection. They're named in terms of the slight differences that we're seeing in the spike protein sort of changes that are occurring on the virus itself. So currently what we're seeing with the Omicron strains going around with acute COVID, the symptoms are often occurring fairly soon after exposure. Prior, it used to be that maybe it would be more like 5 days. We're definitely seeing that it currently with some of the Omicron strains right now, it can be as quick as 2 or 3 days post-exposure. So we can have pretty quick turnaround with symptoms. That's not always the case. Sometimes it can be more like 5 to 7 days, but we are seeing that there's a little bit of a shortened window with some of the symptoms starting. Now, that doesn't necessarily mean that someone is absolutely going to be testing positive on some of the tests. There's some discrepancies now in terms of symptoms occurring when people are testing positive, but just in terms of when symptoms may start to occur, they can start as early as 2 days post-exposure. The most common symptoms are going to be sore throat, fever, cough, muscle ache or malaise, fatigue. We are seeing a return of the loss of smell and taste. Now, that symptom was a very big symptom in the earlier strains of COVID, and then it went away with the initial, it didn't go away, it just became less pronounced with some of the initial Omicron strains in the very early part, like late 2021 and early 2022. We weren't seeing as much of the loss of smell and taste. Since the BA.4, BA.5 forms of Omicron, we've actually seen a return of that symptom. And then in some patients, we will be seeing certain GI symptoms that can be common in some patients. So symptom trajectory, when the symptoms start, they could last 4 to 5 days, or they could even last up to 3 weeks. So there's definitely a variance in what I am seeing and what we are seeing clinically and how long the symptoms are lasting for different individuals. But I do tell my patients with acute COVID infections that we can expect certain symptoms potentially to still be lingering for even up to 3 weeks. So that's not unheard of. When to be concerned. So with the Omicron strains, the really good news is that there's much less of the deep lung infection occurring. We're not seeing the rates of pneumonia that we were seeing with the initial and Alpha and Delta strains. So that's actually a very good progression, a very good mutation that has occurred with this virus. It means it is less deadly, it is less concerning in that regard. However, the biggest concern is still the difficulty breathing. If that were to occur, that's when I would be concerned. The low oxygen saturation. If you have what's called a pulse oximeter at home, where you can put it on your finger, you can test your oxygen levels. If we're dropping below 92%, then I am going to have some concern. That might be when we are going to reach out for emergency medical services. If there is nausea, vomiting, or diarrhea that is so extreme that it starts leading to dehydration, dehydration would be a severe dehydration would be a symptom where we would be concerned and want you to reach out to your physician. And then potentially a fever higher than 104 degrees, depending on how old the patient is and depending on how long that fever has been that high, then those would be things to be concerned. However, in general, I am seeing a majority of my patients get through the current COVID infections doing really quite well. There's a very significant difference in how patients and people are dealing with these symptoms compared to the Delta or the earlier strains. It is appearing to act a lot more like a bad flu for most of my patients at this point during the acute phase. So that's some really good news in terms of where we are with the pandemic and where we are, with this particular virus. So just to talk a little bit more about those changes that we are observing with the virus, another really interesting thing is that the mechanism of how the virus is invading our system and our bodies has changed as well. So, or initially, the initial COVID strains, the Alpha strain, the Delta strain, they were invading our system via what's called an ACE2 receptor, which is a type of receptor on the outside of our cell. So the virus had to bind to these receptors to gain entry and to gain access. The virus has now evolved and it's able to invade via something called endosomes instead of the ACE2 receptors. The invasion of endosomes makes it a little trickier because it can actually invade easier. Endosomes are little packets of viruses that can then actually, they don't need receptors. They can sort of just merge into the cell. This is partly why you might have heard talk about how Omicron or certain strains are becoming more transmissible or more contagious. It's because of that ability to now gain entry via an endosome versus an ACE2 receptor. So that is mutations and changes that the virus has gone through to allow it to gain access easier. Because of the ability of it to get in via endosomes, the damage to the system is going to be a little bit different. There's going to be more inflammatory cytokines and autoimmune reactions that we might see in this mechanism. So those are things that I'm keeping an eye out for clinically, and I'll talk a little bit more about that in a minute. The other thing that we've really sort of noticed with COVID, and this is kind of interesting for me with my acupuncture and Chinese medicine background, which is that we're really seeing this as a disease of the gut and the lungs, which in Chinese medicine, the GI system, the large intestines and the lungs are paired organ systems or paired meridian systems in terms of how energy or qi flows in our body. So I'll be talking a little bit more about acupuncture, which has been shown to be a very effective tool for long COVID symptoms. There's some great research actually that just came out in 2022 on using acupuncture for long COVID. So I love that kind of connection that we can make. So keeping all of this in mind, we then want to think about what are some of the ways that we're going to deal with acute COVID treatment. So goals that we might think about is how can we lower the amount of virus replicating inside our own body if we know that we've had exposure. Reducing inflammation, knowing that there can be a little bit more inflammatory cytokine response, and then also allowing our immune system to have a healthy immune response, not an overactive or an underactive. And so sort of in the world of treatment, if we think about things that are conventional, like medications, really the biggest things that's out there now are the antivirals. Paxlovid is one of the most common ones that has had FDA approval. And that is an antiviral that if it's given within the first 5 days of the COVID infection, it can lower the viral replication and it can help improve recovery in some patients. I have used it clinically in certain patients. There is something interesting that they are seeing happen more and more, which is something called a Paxlovid rebound, where you take the medication for 5 days, but then after you're done with the medication, the COVID isn't cleared from the system and then you have a rebound infection. So I'm pretty specific in terms of patients I consider using this for, but there are certain cases where this can be very helpful if taken at the right time. And then other medications that people might think about using would be things like fever reducers. Now, I am in the world a lot more on our natural remedies, and in terms of talking about all the different natural remedies, there's a lot of things to think about. And this list here is just a few things that you can think about. There's actually a lot more. I didn't have room to put all the different things on here, but certainly when we're thinking about preventing viral replication, for instance, let's say there was a possible exposure or known exposure, and there's concern there. I do think that using intranasal treatments like saline rinses or the neti pot, or certain nasal sprays can be very helpful and very efficacious for cleansing and reducing the amount of virus that you might have exposure to. So I definitely would like everybody to keep that in mind in terms of doing sinus or nasal rinses. If you're potentially traveling, getting on a plane, when you get to your destination, a great thing to do is to do a sinus rinse after that, because, if there's anything you were inhaling or breathing in via your sinuses, rinsing it out can actually make a big difference, because if you can remove some of those viral particles that you potentially inhaled, that is certainly a great way to reduce exposure. Of course, I'm not going to get into sort of this whole thing, but masks do work because they're going to prevent that exposure route for us. When it comes to actually having acute COVID coming down with the infection, fever, a really amazing treatment that has been so helpful in reducing fever for many of my patients is something called the wet sock treatment. It sounds really funny. I'm going to describe what it is because many of you may have no idea what it is, but essentially, when we have a fever, at night, we can do a lukewarm shower or bath, and then prepare a pair of socks where you've gotten them wet, put them under water, and then wring them out, and then put them in a bag in the freezer and leave them in the freezer for 30 minutes to a few hours. After you take a lukewarm shower, you don't want to do anything hot because you don't want to increase your fever temp, because temperature and fever tends to spike in the evening and at nighttime. That's because your immune system naturally lowers at nighttime, because our cortisol, which is one of our hormones that helps modulate and manage our immune system, naturally drops at night. And then we don't have the same suppression of some of the virus and the symptoms that we did when our cortisol levels were higher and our immune system was working better. So fever often spikes at night. So this is a good time to do it. And then you take your lukewarm shower, and then you get ready for bed. And then you put the frozen socks out of the freezer on your feet, cover them with a pair of thicker, dry socks, and then get into bed, get under the covers, and sleep ideally with those socks. And what happens is it's an effect where doing that hydrotherapy, that cold on your feet, will draw the fever and the temperature down from the head and out of your system. And it can absolutely bring fevers down several points. It's very effective. It's also very effective on children for fevers. It's one of my most commonly recommended fever support treatments for children, but it works on all of us. Immune support, a few things that I definitely am always thinking about specific with the COVID is going to be vitamin D, vitamin A, some magnesium. Now, magnesium might be one that you may not be thinking about as immune support, but magnesium is actually very, very helpful for our T cells, which are an arm of our immune system that are very important. So magnesium is great. Andrographis is a super potent Chinese herb. It's one of my favorites. Mushroom extracts, lots of different mushrooms are very antiviral. Probiotics, thinking about the gut. Monolaurin, that's another antiviral. That's a natural antiviral. And then things that we can take to prevent viral replication. There's something called lactoferrin. It's a type of a iron sequestrating that has had some really good studies on specific with COVID and preventing that viral replication. Quercetin and zinc, which have been talked about for kind of the whole whole time of the pandemic very successfully. And then we want to reduce inflammation. We want to think about our omega-3 fatty acids, ozone. So ozone is a treatment that we do a lot here in our clinic. And so when we think about ozone, we actually can get ozone encapsulated in pills, capsules that you can swallow. And then also, as we're kind of going through recovery, there's ozone IVs. In fact, dozens of my patients who have had acute COVID who live on island, I will actually recommend that they do a rectal ozone treatment, and I'll send, you know, a family member down to the clinic to pick up syringes of ozone that patient with COVID can then administer rectally on themselves at home. Very, very effective. Ozone is O3, so it helps add oxygen to the system. It's also very anti-inflammatory. NAC, N-acetylcysteine, glutathione. Definitely we can do oral glutathione after sort of the symptomatic time frame. We can do IV glutathione and even nebulized glutathione. Very, very helpful for any of the lung symptoms or cough symptoms that are going on. And this is something that we can use and prescribe from compounding pharmacies. And then there's some simple homeopathic remedies that are very helpful for the acute COVID. And these are the same ones that we would think about with acute flu. Bryonia, we think about if the symptoms are that the patient is so sore and so sick that they just want to lay in their bed and not move. Like the only thing that makes them feel better is literally just laying as still as possible and not moving. And they're kind of like getting a little bit irritable. Definitely everything's uncomfortable. That's when we think about bryonia. Belladonna is a great remedy to think about if the fever comes on really quick and it's really high and there's really red cheeks and there's just a lot of flushing and a lot of fever. So those are some homeopathics that, you know, I think about, especially in kids, because kids are great to kind of use homeopathics with. Okay. So let's transition to a little bit about long COVID. I am going to circle back after we talk about long COVID and chat a little bit more on acute COVID and sort of my own experience and some things like that. But I want to make sure that we have time to talk about long COVID as well. Long COVID or long hauler syndrome or long haul COVID is something that is diagnosed based on symptoms that are presenting, meaning someone has had a COVID infection and then the symptoms are persisting after the infection for longer than 3 to 4 weeks. The most common symptoms that we will see that it will be associated with the long COVID is going to be fatigue or lack of energy. That's one of the biggest ones. Then there can be brain fog, there can be insomnia, there can be anxiety, there can be lingering lung and breathing issues. There can be lingering GI issues. There can be a lot of lingering issues, but what I've listed here are some of the most common ones. In terms of risk factors for long COVID, it appears now, you know, we don't know a lot about long COVID because obviously this is fairly new. There is a lot of studying going on about it. There's certainly clinical sort of observations that we have, but some of the things we know or suspect as risk factors can be just being female, having pre-existing conditions. So type 2 diabetes as a pre-existing condition, that is a pretty significant one. Those individuals are 4 times more likely to get long COVID. So big increase in risk of the long COVID with type 2 diabetes, especially if blood sugar is not controlled. Now, I have some patients with type 2 diabetes who right now, their blood sugar is perfect. It's perfectly well controlled. Yes, they have that diagnosis or disease, but it's completely managed. This would be an increased risk in those who really have an unmanaged. It's not, the blood sugar and diabetes is not being managed properly. And then obesity is a known pre-existing condition that can definitely contribute to long COVID. The other one is having an autoimmune disease or simply having the presence of autoantibodies, meaning antibodies that we see in the blood work that are known to attack ourselves. Also, having any other type of high viral or infectious load before getting the COVID virus. So EBV, which is Epstein-Barr virus, CMV, which is cytomegalovirus, even patients with Lyme or chronic Lyme disease. If I have patients who are already dealing with reactivated infections or ongoing infections, I'm a little bit more concerned with the possibility of another infection on top of that, that then the immune system is not able to do anything about, so then it turns into long COVID. And then having elevated levels of inflammation as a baseline individual, that could put us at higher risk for long COVID. Okay. So when we think about long COVID, I think the most important thing to realize or to kind of understand is that there is no known medical mainstream treatment for long COVID. And that is really kind of sad and a little scary. So that is partly why I want to talk about that today, because in the world of integrative and functional medicine, there's actually a lot of things that we can do and a lot of things that we are seeing that are helping individuals who might be experiencing long COVID. So the goals that we're thinking about in this situation would be focusing on how the gut barrier and the microbiome is functioning, thinking about improving GI function, thinking about supporting sleep. So one of the things that they have shown in the research is up to 40% of patients with long COVID sequelae have severe sleep disturbances and the severe fatigue. So we really need to think about what's going on neurologically that is affecting sleep. And we do know that part of the situation with long COVID is that there seems to be more neurologic type symptoms with the brain fog, the sleep issues, the fatigue. So the virus is affecting the neurologic system in a way that we need to be addressing and thinking about. Then we also need to think about mitochondrial support. If you know what mitochondria are, they are one of our favorite little organelles. So mitochondria they are organs inside our own cells. Every single cell in our body should have many, many mitochondria. They are extremely important because they are the energy powerhouses of our cells. They make our energy. And what we know is that viruses, toxins, environmental toxins, radiation, very specific certain things can damage or kill off our mitochondria. So these types of COVID viruses can be damaging and can leave us in a state where we are lacking mitochondria, which means we are going to lack the ability to make ATP or energy. So those are kind of the goals we're thinking about with long COVID. Testing. Mainstream medicine says there's no way to test for long COVID. It is simply a diagnosis that is based on your symptoms. However, in my world, I do a lot of testing, so there might be things that I would want to test or screen for. I have a little list here. I definitely would want to be looking at autoimmune markers. Anti-thyroid antibodies, there is actually a very large percentage of autoimmune thyroid conditions that are occurring after COVID. I have had several in my own practice, and I have talked to an endocrinologist on the island who has seen a large number of that as well. So we definitely need to be thinking about our thyroid antibodies. Markers for the heart and the cardiovascular system, like D-dimer, that's a marker for clotting, and NT-proBNP, which is a marker for how well the heart as a muscle is functioning. We want to think about zonulin, which that is not tested via a blood test. That's actually something that can be tested via a stool test. And that's going to tell us about the gut barrier function. And it's a indirect marker for leaky gut, which can occur in long COVID. Chest x-rays can be done. There's a high percentage of something called ground glass appearance nodules that we're seeing on the chest x-rays in some of our patients with long COVID. So that might be something that we would consider sending someone for if the symptoms have been lingering and we're thinking that the symptoms, there's a lot of like coughing and GI and lung stuff still going on. And then I may want to test for other infections. I might want to test levels of EBV, which we can do on blood work. We can do CMV, potentially testing for Lyme disease, those kind of things. We would potentially want to look at and see how many other viral infections, what's the viral or infectious reservoir that we're dealing with. So, natural remedies that we would think about for long COVID. There's a lot. So I think about it in systems. So we have our GI system. So we may want targeted probiotics. We may want something like zinc carnosine or glutamine to help heal the mucous membrane of the gut barrier. Definitely a healthy diet can make a very big difference. I will say the other thing is that a healthy diet makes a really big difference ahead of time. So if there's still risk, if you're someone who still has not caught COVID yet, or you have had it a while ago and you don't want to get it again, definitely thinking about what you can do with your diet to already strengthen your GI system to prevent this type of long COVID, I think is really important. Then we need to think about sleep. So there's lots of things that we can do for sleep. There's melatonin, magnesium, passion flower, L-theanine, L-glycine, lavender, valerian. You know, definitely if you're someone who is experiencing or suffering from long haul or long COVID and you have not sort of reached out to your integrative functional medicine doctor like myself or Dr. Steelsmith or anybody else you see, definitely, you know, reach out to us and, you know, have us do an assessment and figure out, you know, which of these foundational areas do you need some more support in? And then the mitochondria, those energy powerhouses, we are thinking about CoQ10, L-carnitine, taurine, NAC, vitamin D3, NADH, the ozone comes up again. So ozone has this amazing ability because it's adding oxygen to our system, and our mitochondria are very big oxygen users to make our energy. So adding that O2 via the O3, very, very helpful for mitochondria replenishment. Then we want to think about our lungs. There are some very great breathing exercises that I do recommend anyone with long COVID who's suffering from a lung or respiratory issues be thinking about or doing, but really focusing on working and expanding and contracting that lung tissue. And then I like to think about adaptogens, which is a name for different types of herbs that help our adrenal gland function, because the high levels of fatigue that most people with long COVID experience, they're going to need a lot of that adrenal support. Holy basil and ashwagandha are two of my favorites. And then acupuncture and Chinese medicine. So, you know, acupuncture as a treatment modality, I think has a lot of validity in what's going on with some of this long COVID. So that's another thing I would absolutely consider. And if you have friends or family on the mainland who are suffering from long COVID, there are acupuncturists kind of all over now. I mean, acupuncture is very well known, so that would be something that I would definitely recommend people seek out. And then, you know, some other things I don't list here that we do specific in our clinic are going to be more of like the IV intravenous nutrient therapies, ozone being one of those IV types of treatments, but we have a lot of other IV bags that we will formulate that have some of these different nutrients, things like NAD that we could consider. So that's always something that, you know, on a case-by-case scenario, as I'm working with patients, I may very much recommend. All right, so this is a little bit of a stunning statistic, which is kind of one of the most recent ones, which is 20% of non-hospitalized patients in the US will get long COVID. And 50% of hospitalized patients they suspect will get long COVID. So those are some 50% is a pretty large statistic. The 20% statistic, I'm going to say that I have not seen the 20% statistic in my patient population. That percentage is actually a lot lower in my patient population, but I do believe that, so many of you all out there and so many of our patients know a lot about how to try to keep themselves healthy and, know to call us if they've gotten COVID and know to do a lot of these extra things that honestly, most people who see just conventional medicine are not going to be told to try all these different things that I've just been telling you all about. So I will say that the percentage of patients in our clinic who are getting long COVID is much lower than that, which I think is really exciting and really amazing. But I absolutely have patients who are dealing with long COVID and who are going through long COVID. And so, it is happening and it is something that we need to be really aware of. And so I think all the more reason to, attend this webinar, see what are we doing? What are we talking about? What are the things to think about so that that is something that you can, potentially think about preventing for yourself and your family. All right. So I have a little bit of time. All right, so I'm going to talk a little bit about my personal experience with COVID and my family, just because I think it's kind of interesting, a few of the things that I learned with our infections. So I'm going to talk about what's on the screen here in just a minute, but first I'm going to kind of give you some background. So I have currently a 9.5-month-old baby. She was 8 months old when July 4th weekend, we had an exposure. She had an exposure from her caregivers, and her caregivers are actually my parents. And unfortunately, they somehow were kind of out and about doing some sightseeing, and we think must have had the COVID exposure because I saw my mom on a Saturday and she was having a little sniffles. And I said, "Mom, why are you sniffling?" And she said, "Oh, my allergies have been acting up for the past few days." And I said, "Are you sure it's not COVID? Did you test for COVID?" And because they watch my baby like 5 days a week. And she was like, "Oh, no, I didn't test, it's allergies." And I'm like, "Go home and test for COVID now." And then I get this text a little later that's like, "Oh, your dad and I tested positive for COVID." And so, good news for them is that their symptoms were extremely mild and she just thought she was having her regular allergies. So that was great. So that was a Saturday. Sunday morning, I wake up and I can tell that baby Bowie, that's my daughter, is like not doing well. She does not want to wake up. She is really out of it. I'm like, I touch her. She's like burning up. I take her temperature. It's like 103.4. So then I'm like, oh gosh, okay. So she's definitely has COVID. I test my husband and myself. We have no symptoms and we test negative. So where we're starting from is the baby had exposure. Most likely my husband and I did not have exposure yet, but any of you who are parents know that what do you do with an 8-month-old baby who is sick? Well, if you're the mom, you're basically holding her all the time because she's so sick. So I was kind of like, well, there's no way that we're not going to get an exposure now. So let's do everything we can to bump ourselves up with all of these things and see if we can, prevent it. Because up until this point of the pandemic, no one in my family had actually gotten COVID yet. So this was our first, experience with it, with a big exposure. So my husband and I are taking all the things we can, everything on that list, plus a lot more. I'm getting, rectal ozone, and we're doing rectal ozone even before we're symptomatic. And actually you can do rectal ozone on infants. I'm giving it to the baby. So we're doing all the things we can. And the baby's definitely sick. She's mostly have a fever and just super lethargic. Good news is that she ended up doing fine. She had symptoms for about 48 hours. And then by the third morning, so she was sick Sunday, Monday. By Tuesday morning, she was turning a huge corner. Her fevers were under 100. She was definitely feeling way better. So it's really a short window of illness for her. My parents ended up doing fine. They really didn't have many symptoms at all. I will say my parents, who are both in their 70s, had received their second booster shot a few weeks prior to getting sick. So that may have made a big difference for them. The Tuesday morning, baby's feeling better. My husband starts getting symptoms, sore throat. I'm getting some symptoms, little sniffling, little sinus congestion. We test and we're both positive on Tuesday. So that was basically day 2 to 3 of it after exposure, where both of us tested positive. What I have on the screen here, what you're looking at, is you can see this little date up at the top where it says Wednesday, July 6th. These are metrics from my Aura ring, which if any of you have watched my sleep lecture or maybe work with me in clinic, you may have heard me talk about my Aura ring. It's my favorite biohacking tracking device. It measures my sleep, my HRV, body temp, all kinds of things at night. It's really amazing. If you have other questions about the Aura ring, definitely, shoot me a message. I'm happy to talk more about that. I check my Aura ring metrics every morning to see what was happening in my body overnight. And a few things are really problematic on Wednesday morning. And Wednesday morning, I think Wednesday was the day I felt the worst. I felt body aches, muscle pain. My fever was 101. Just felt really like flu-like and unwell. So you can see my resting heart rate at night, overnight asleep, was at a 78. Usually I'll pull up what I am usually, which we'll just switch to the next page. Yeah, usually my normal resting heart rate is 48. And I was at a 78. Something called heart rate variability was at a 12. That's extremely low. Usually I'm at a 70. That's a marker of how well your nervous system is doing overnight, parasympathetic versus sympathetic tone. My body temperature, this is not reflective of like a 98.6. This is just saying how much above or how much below your baseline you are. I was 3.6 degrees above a baseline at night. That's probably the highest body temp reading I've ever recorded on my Aura ring in over 4 years. And then my respiratory rate, my lungs, my breathing was at a 17.2. Usually I'm at a 12.5. So that was some markers that I have never seen on myself before. So I knew like, okay, I've definitely had a pretty big viral load exposure. And what I found pretty interesting was that, my husband and I had a heads up. We had a few days ahead of time that we knew, okay, we're going to have this exposure. Let's try and do everything we can to see if we can like prevent. And what was interesting to me is that we really, despite our best efforts, we couldn't prevent it. And we did get a really big exposure. But, some of the interesting research on Omicron variant specifically, and this is for anybody who deals with kids or has kids, maybe your teacher, or you have your own kids or grandkids or whatever it is. It appears that the Omicron variant replicates extremely well in child and children sinuses and replicates better in children than in adults. And, one of the things that I think may have happened is that the baby, she's completely unvaccinated to COVID. So she had, nothing to have any prior knowledge of how to deal with this virus. So when she got her exposure, she basically had a extreme viral load. And so that amount of viral load that we were exposed to was also really high. I did not wear a mask around my own baby. That just wouldn't have been appropriate for, you know, what she needed from me and, you know, the snuggles and everything that she needed. So I didn't mask around her. Obviously, I probably could have and prevented some of that intense viral exposure. So that's a little bit of the background in the story of what we experienced in early July. Our symptoms lasted that week. I did experience loss of smell and taste, but that did not occur as one of the first symptoms. That occurred maybe 3 or 4 days after all of our symptoms started. And, you know, if any of you have experienced those symptoms, actually very bizarre, you know, especially the sort of loss of taste, because nothing really tastes the way it should. The good news is that for us, those symptoms went away and our smell and taste did return within a week. And, you know, my whole family made a full recovery. We did not have any long COVID symptoms, but I also think we were doing tons and tons of things to deal with inflammation, deal with our immune system, deal with our GI. You know, we were doing all of these things. So we had very good outcomes. And so, you know, this was Wednesday, July 6th. Oh, is this not on here? Hold on. My date. I think this was like the 14th. Oh, can you guys see the date? Maybe my screen is just blocking it. But anyway, these readings on the screen were July 14th. So, you know, not even 10 days later, and all of my metrics in terms of respiratory, my heart, my cardiovascular, my nervous system had sort of bounced back to their norm. So that is, you know, really good. And I will say, you know, just the plug, I don't, you know, Aura doesn't give me any kickbacks, but I think these rings are really useful info to kind of allow us to understand when we've recovered with these kind of infections. So just a little bit of interesting stuff. And now I want to get to questions. So let me see, chat. All right. Okay, so we have a question. The T cells, if these are creating autoantibodies in long COVID, would magnesium help that? How much would you recommend? I'm taking Mag-Taurate. This is a really great question. So asking about what I said about magnesium helping the T cells in our immune system. So if the immune system is triggering autoantibodies in our system, then I would actually think about everything on that list for the immune system, right? Because what we want to do is we want to regulate the immune system so that it doesn't go overboard and start triggering autoantibodies. And dosage for magnesium, I'm not going to give, you know, like anything super specific, but ranges anywhere from 100 to 250 milligrams are really quite safe. And those would be sort of starting ranges of magnesium. And there's lots of different forms of magnesium. It doesn't seem to matter. There's magnesium taurate, there's magnesium glycinate, there's magnesium threonate, there's magnesium citrate, and it doesn't appear that the type of magnesium seems to make a difference. What can be done for the brain fog from COVID? So the brain fog is going to be in the neurologic realm. So I would want to really think about and make sure that sleep is happening really well and make sure that you're actually getting deep and restful and recovery sleep. I also would probably be thinking about some of the mitochondrial support because your brain needs a lot of energy to deal with the brain fog. I might be thinking about some of the adaptogens. And then I may also even be thinking about some IV therapies, depending on, you know, how bad the symptoms are and the sort of baseline of how your brain was functioning before. But I probably would be looking at a sort of multifactorial approach, kind of like what I talked about there, but definitely looking at your sleep, definitely looking at your mitochondrial support, definitely thinking about glutathione. That would be a really big one. And I may even think about intranasal use of glutathione, where we compound it so you can actually snort it and that goes into the brain, but even maybe IV glutathione, I would think about a lot of that. What is your opinion on vaccines for toddlers, specifically around 1 to 2 years old? Okay, so I don't want to get into a huge debate with the vaccines, but I will give you my own opinion, which is we need to understand the risk factors in the individual themselves. Meaning, are we concerned with family history of autoimmune disease? Are we concerned with family history of type 1 diabetes? Because one of the biggest things we're seeing in the young children is that there seems to be a higher prevalence of developing type 1 diabetes after a COVID infection. And that is something that is a lifelong disease that if we could prevent it, that seems really important to me. So I have some patients who, there's like the dad has type 1 diabetes and he's had it since childhood. And so if they have children, I might be thinking like, I'm a little concerned about that sort of genetic propensity, and I may consider the vaccine. I have had children in my practice who have gotten the vaccine and have done completely fine with it. I'm not overly concerned with it. I will say that I found it really interesting, the difference between the Pfizer and the Moderna dosing for the under 2 years old. The Moderna is using a dose that is 1/4 of an adult human dose, regular sized human dose, whereas Pfizer's dose is 1/10 of sort of an adult dose. And to me, I don't know a single 2-year-old or under that's 1/4 of an adult weight or size. So I feel like the Moderna is a really high dose. If I have, children in my practice who are getting it, I am recommending the Pfizer. The difference is a 2-dose versus 3-dose series. So it takes longer to complete the Pfizer and gain that protection. But in terms of dosing, I just feel like the Moderna is a really weird high dosing for children. Could I please give an example of your daily breathing exercises? Okay, yes. So depending on how bad the lung sort of status is, there are actually, if you Google or YouTube prone breathing exercises for COVID, you will get a lot of videos of how to do breathing exercises laying face down. Because one of the things that tends to happen is that when we're laying on our back, we actually restrict the posterior lung ability to move, and that can tend to be where then we get some inflammation and restriction. So we actually want to do breathing exercises where we're laying face down so we can expand those posterior lung areas. So if you're curious, I would recommend just Googling or YouTubing breathing prone, P-R-O-N-E, prone breathing exercises for COVID. What are your thoughts about getting future booster shots and those who have never been vaccinated? So future booster shots, I am doing a case-by-case basis now with my patients. I'm not necessarily recommending that anyone and everyone be getting more booster shots. There are particular ages and situations health-wise where I might still really want to be protective of those individuals. However, the booster shots right now for the Omicron variant appear to give you a window of a few weeks of extra protection. That's not very good in my opinion. I don't know if we will be coming out, if they will be coming out with vaccines that look better for Omicron. So right now, the majority of my patients, I have not necessarily been recommending further booster shots. For those who have never been vaccinated, I really think that that's a personal, they've made a personal decision there, and I prefer to have that conversation with them one-on-one to understand why they're not doing vaccinations. There might be health reasons, there might be particular situations going on. But I will say that because I see patients, a lot of patients, I have plenty who are vaccinated, I have plenty who are unvaccinated. I will say that with the Omicron, the illness itself seems to be much milder. So that's very good. And it seems to be much milder in vaccinated and unvaccinated. I will say that my patients who have had increase in thyroid autoimmune antibodies after an infection have all been unvaccinated, just as an observation. So there might be something going on in those who have not been vaccinated, who have not had exposure to the virus, where they're having a bigger response to that viral infection. But I'm happy to talk further with anybody personally about sort of those decisions. I sought treatment for long COVID for the very first time ever with acupuncture. I've suffered exhaustion and exercise intolerance symptoms for 9 months. People say it relaxes you. I find it exhausts me. It takes me out for 4 days. This is discouraging and makes me feel worse. Can acupuncture energize you? Should I stick with it? Any comments? Interesting. So I have a few other patients who have done acupuncture and have had complete exhaustion from it. That tells me that there is something really major going on in their adrenal glands, and that sort of any change in energy flow is almost too much for their system. So I'm not sure if you're seeing acupuncture or if you're doing acupuncture with us, but if you were my patient, I would probably want to take a different direction and make sure that the other things I have you on or that we were doing together were looking into why that exhaustion is occurring. Because having it take you out for 4 days, no, I would not expect that. And I would say, I don't know that I would continue with it for now. Traveling to the mainland, are there any vitamin supplements I should take before I travel, and anything that I should take along just in case? Okay, great question. I would say that one of the biggest ones is lactoferrin. I alluded to that on one of the pages as something that prevents viral replication. I think, anything you can do to just, if you get the exposure, prevent the virus from replicating. So wearing a mask, if that's something you do, rinsing your sinuses. Sometimes if you're in a plane or in a crowd, one of the other things that you can do is get like a natural Vaseline alternative and put it on the inside of the nares, the nasal membrane, because that thickness there also prevents viruses from traveling up and in. And then I would say using lactoferrin, you can, as a preventative, take like 1 a day. And then if you get sick with COVID, we have instructions where you can increase that dose. Thank you. Great information. Thank you. Thank you for listening. All right. Yep, COVID got the family almost around the same time as your family. It was last month, exposed on the 9th. First symptoms appeared 7/13. Me not feeling much better. Ooh, relapse. Thought you had a relapse a week ago because I felt a sore throat happening again. I definitely need to see you right away. Okay, that's okay. Please contact me. Maybe shoot me a quick email so that we can get on top of this, and let's get some things going and help you do some things. Okay, thank you. Okay, and then I had a question that came in on an email ahead of time. So this patient is post-COVID, about 2.5 to 3 weeks, wanting to know if there's suggestions, still having sore throat, a cough, some lung, sinus, mucus, and drainage. Okay, so some of those lingering, like the sore throat, the cough, the lung stuff, I really think about N-acetylcysteine, NAC, and glutathione, and maybe even nebulized glutathione to get into the lungs. So those are some of the things that I would definitely be thinking about. Maybe if the sinuses are still involved, we actually do an injection in our office that's a sinus ozone injection, where we actually inject a little bit of ozone right up above the maxillary sinuses right here. And then that ozone seeps into the sinuses and it can reduce inflammation. It can kill virus that's in there. So I would think about, sore throat, cough, lingering respiratory symptoms. I'd think about NAC, N-acetylcysteine, glutathione, maybe a nebulized inhaled glutathione, and then maybe sinus ozone injections. Okay, I think I've answered questions. Good. All right. Wow. And it's 4:58. I feel like we've done a really good job. If you have any other last remaining here, isn't lactoferrin found in colostrum? Do you recommend continuing breastfeeding throughout for babies? Yes, lactoferrin is found in colostrum. That is correct and true. And I do recommend continuing breastfeeding. So when the baby was sick, I obviously continue. I'm still breastfeeding her. She's, 9 months only right now. I continued to breastfeed her. Even when I got sick with COVID, I did continue to breastfeed, and it is recommended that you continue to breastfeed. In terms of, extending how long you continue to breastfeed babies with this whole COVID situation going on, I would say I have recommended to some parents to, if possible, continue to do some breastfeeding, because there is going to be some provided protection. Obviously, I was breastfeeding. It didn't necessarily give, protection enough to prevent the baby from getting a full-blown COVID infection, but she did well, and, she's doing well. So I have to think that that was helpful. All right. Great. Thank you guys so much for tuning in. I really appreciate everybody popping on. I hope that this was helpful and a good update. And absolutely, Dr. Lori Steelsmith and myself, Dr. Coles, we are here for any and all of you. You can reach us via email. You can reach us via our phone number. You can, follow me on Instagram. Please, don't be strangers. We are here for all of you guys, supporting you guys through 2022 and beyond. We're still here. So, we'll keep doing all that. And thank you guys for tuning in. And I'm going to sign off. I hope you guys have a wonderful evening, and we will talk soon.